Let's talk compression. Compression garments are used very frequently after surgery, and not too many patients appreciate them. They aren't always super comfortable. So why do we tell patients to use them? There are many different reasons why surgeons tell patients to use compression after surgery. Let's talk about a liposuction case. When we do liposuction, we have to pump patients full of a vasoconstricting or blood-constricting fluid prior to doing the surgery because that decreases blood loss. So as you can imagine, we're pumping fluid in, we're pumping fat out. You still have a residual amount of fluid in your body that can lead to swelling, which can lead to discomfort, which can also lead to decreased wound healing. So we want to compress it after surgery to help the fluid be reabsorbed by your system or be pushed out through any incisional openings. The other thing particular to liposuction is that a successful liposuction relies on your skin's retraction. Imagine it's like saran wrap. After the fat's removed, since there's not an actual skin excision like in a tummy tuck, the skin has to retract down. So during that period of time where the skin's retracting, if there's a lot of residual fluid, it can't contract down as much as it wants to, and you might not have as a wonderful aesthetic outcome if you could have, did you use post-operative compression. Another reason why I use post-op compression in my breast reconstruction cases is to prevent fluid from coming in. Let's talk about a direct implant or a tissue expander placement at the time of mastectomy. I use 2 drains. Some people use 1 drain. I choose to use 2. When I remove that second drain, your drain output still isn't 0, so your body is still producing fluid. If there is a potential space, your body's going to keep putting fluid into that space. So I have my patients use some post-operative compression to decrease any available space. If your skin and tissue is being contracted or compressed, there's just no space for the fluid to go in. Now, why do we care about fluid? We've talked in other videos about seromas and why seromas or fluid collections can lead to things like discomfort and infection and wound breakdown, which can be very bad, especially in implant-based breast reconstruction. Now, I will tell you, there are not good randomized control trials or high-quality evidence telling surgeons how long patients should wear their compression for. So a lot of what we recommend to patients is based on anecdotal experience and what we found in our own practices or in the practices in those who we trained under to be successful. So if your surgeon has a different protocol than one that you read online, that's why there's really not a lot of science behind that. If you had surgery and you had to wear compression, tell me your thoughts and let me know how long you had to wear that compression for.